Now, all week here on the Midday, we are talking about body image this week. It's about how we see ourselves, what we think we look like. Well, sometimes it can bear a close resemblance, and for some people, it does not. Ashley Heintzelman is here to kick off this week and talk about some common mistakes that people make. Now, Ashley, tell us, your expertise then is as a psychiatrist.
Psychologist.
Mm-hmm. And body image and the whole image that the way we see ourselves, where do some people fall on that Richter scale?
Well, some people, it's very, very accurate. What I'm seeing people when they're coming to us, and usually it's not so accurate anymore. I specialize in the treatment of eating disorders, and a lot of times if individuals do have some type of body distortion, a lot of times they try to manipulate their body shape, and we see that through exercise and diet, and often purging behaviors as far as trying to rid the body of calories. Also, we see people doing restrictive type eating, and that's by the time that they're really demonstrating a lot of behavioral issues is what often brings individuals to treatment.
But there is help. How do you help someone deal with these issues that they're facing?
Sure. Unfortunately, once individuals do come to treatment, they need more than just an individual therapist. I touched on the behavioral part of eating issues, the actual dietary component when people are either restricting or compensating in some way. So they really need a team approach that addresses both the cognitive piece of it, more the way they're feeling and thinking about their body, as well as the behavioral component that's usually addressed not only by an individual therapist, but also addressed by nutritionists, also addressed in group therapy where they're being around peers that are also dealing what they're dealing with, so they can start to understand how other people are involved in their own recovery process.
So it's a team effort. Is getting the person to get help one of the first and most difficult steps, honestly?
I would say one of the most difficult things is getting the first steps, but also keeping people engaged once they are there is another difficult part of it, often because of the time it takes. Unfortunately, the recovery process is a journey, and it's a process. And it's really a team approach is needed. So once individuals are engaged in treatment, one of the tricky parts can be keeping them involved with treatment.
But it is possible, and people are getting help and getting whole and getting a true identity of their body and coming back to life, so to speak, almost. All right. All right, well, we have more information on our website, as well as you guys have a website as well.
Yes.
Tell us what it is.
That is insightkc.org.
Insightkc.org. All right. Thanks so much for being here. We appreciate it. All right. Let's get